do I need to get off your table?
Can I just have the end of that table?
I can get that for you.
Thank you.
Since I took the table over, yeah.
I know.
Good afternoon. My name is Frank Haney, Winnebago County Board Chairman. I am joined again with Rockford Mayor Tom McNamara and Dr. Sandra Martell, the Winnebago County Public Health Administrator. I'll be very brief in my remarks today. I'm very concerned when I hear public health and medical experts around the country and folks expressing concerns locally even of what we're seeing in other parts of the country that opened up sooner than we did. And so that is a reminder to us to stay vigilant around things, again, not to be a broken record, but things we've been talking about for 3 or 4 months. The work we did to get ahead is going to have to be the work that we double down on to stay ahead in the weeks and months to come. And if we continue to stay vigilant around mask wearing, around social distancing, washing our hands, that gives us our very best chance. We just, of course, last Friday moved to phase 4, which is something we all welcomed. And we do know and have acknowledged and will continue to the very tough plight of our business community, in particular our small business partners. And many of them have been the ones closed the longest and are now opening back up and finding their way in this new normal. I think we have an obligation to them as well as to our first responders, as well as to our frontline healthcare workers, that we continue to do the basic fundamentals of fighting COVID-19. The idea that we are allowing for the politicization of mask wearing is unacceptable to me as a citizen of this community. This is something we need to do. I wear a mask when I go into a store to protect you, and I ask you to wear one to protect me. If you're asked to put on a mask walking into a store, please comply. Business owners are going through a lot. They're adjusting. They're doing everything they can to open back up and stay open, and we want it to stay that way. We all have a role to play in this, folks, and so we do need your help. Whether, again, you are thrilled with every action that has been taken by the state, by the governor, or you've disagreed with certain actions along the way, at this point, that is irrelevant. All that matters is what we do today and tomorrow around slowing the spread of COVID-19. What is the one thing that has not changed? What is the one thing? The one thing is this. We know that COVID-19 will be with us until there is a treatment or vaccine. And that has not occurred at this time and will not in the very near future. And so we have to continue to remain vigilant. With that, I am going to again turn it over to Dr. Martell. And I would again, for folks, regardless of what your political persuasion is, it is bothering me as somebody who grew up in this community, who's raising a family in this community, and is serving in this community now. I don't want to have political discussions about mask wearing. If this thing keeps people safe, if it turns out to save lives, if it slows the spread of COVID-19, then let's do it, whether we love it or not, and it will help us have the most opening of our economy the fastest, and for us to sustain that as we go forward. With that, I will turn things over to Dr. Martell for the public health update. Thank you.
Thank you, Chairman. I keep reminding everyone, even as we are in phase 4, that we're learning to coexist with COVID-19. I don't know how to put it any nicer, how many to make it feel better, but we are going to be coexisting. And I want to warn everyone that it will last longer than 28 days, as our other phases kind of move through 28 days. Because really, phase 4, moving into phase 5, will require either that we have an effective treatment or a vaccine. So we need to continue to both kind of look at our individual and our societal at risk. So the chairman gave me a great introduction on this. I want to be clear with everyone that risk cannot be totally eliminated. We cannot go to zero risk. But it's all about reducing the risk. So we're going to have a little conversation today for the public about what's safest and what's the highest risk or the riskiest. So safest, outdoors, wearing face coverings or masks, 6 feet of social distancing, small group size, less than 50, contact time less than 15 minutes. That is the safest, if you think about the framework. So we're going to go with what's the highest risk. Indoors, not wearing face coverings or masks, not maintaining 6 feet of social distancing, group sizes more than 50, and contact time more than 15 minutes. So think about, as we go through some of this, kind of a checklist in your own life about when evaluating, what am I going to do today? What do I want to do today? What should I participate in? What do I really want to put my energy and effort toward in phase 4? Because again, you have to assess your risk. I often hear about, the government telling people what to do. It's now time for you to assess what your risk is. So as we go into summer travel plans, so again, think about this. What would be the safest? We're coming up on our big travel weekend for many people to go out, visit, and enjoy things. Staying in a region or traveling to a region with the same rate or a lower rate of infection. Traveling in your own vehicle. Staying with your own cohort or household, so people that you normally keep in contact with. Wearing your face coverings and maintaining social distancing when you're out and about where you travel to. Travel plans for highest risk. Traveling to a region with multiple outbreaks and or higher rates of infection than our own community. Using a public mode of transportation. Why? Because you're in a group size. Staying with a new group or household. This is why there's concerns about things like cruise ships and things where all of a sudden you're put together with households, multiple households and cohort groups that you've never been with before. And not wearing a face covering or mask or social distancing when you go out and about. I have to tell many of our, listeners, viewers, we get calls from other states asking about our infection rate and whether or not our visitors, when they go to other areas, are wearing their face coverings and are they bringing the infection to them. And I come back to, again, it's about safe, safer, higher risk. So each time that you're thinking about what you're going to do, what are you going to travel, what your plan is to do, think about how can I make it as safe as possible. Understanding we can't eliminate all risk, but how can we avoid the high risk? So here's a checklist to consider when you want to take on that risk. Can I afford to be off work for the minimum of 10 days if I become ill with COVID-19? Will my employer cover time off for illness that I acquire in the community? If I acquire the illness in the community, will my employer cover that time off? Am I at risk of requiring hospitalization if I contract COVID-19? Do I have an underlying health condition or an underlying propensity for a health condition in my family that may place me at greater risk? Do I have adequate health care coverage if I require hospitalization? Well, our hospitals have capacity. Is this where I want to be spending my income? Who will take care of my family member if I become sick with COVID-19? What will I do in the fall if COVID-19 cases increase and my children can't return to school? And my work, I need to return. How will I pay my mortgage or rent if I'm out of work? Are other people in my household at high risk? Do I have a pregnant member of my family? Do I have infants, children, parents, or grandparents? If we have to move back to phase 2, is my employment at risk of having to close because they can't maintain? And am I willing to contract an illness for which the long-term implications are unknown? I often hear, well, younger people get milder cases. What we don't know is in 15, 20, 25 years, whether you're at increased risk for another condition because this damaged some portion of your system. So I come back to the statement of, is it really worth the risk to you, your friends, your family, your colleagues, and more importantly, and most important as we come together as a community, your community. So while you have individual choices, you have to consider the impact overall. So as we went into phase 4, the COVID-19 and hotline continued to receive complaints from both businesses and establishments regarding clients and customers who do not wear masks, and from clients and customers who indicate that businesses and establishments are not wearing masks. Common theme here, not wearing masks. So the Winnebago County Health Department and the City of Rockford Code Enforcement will respond to repeated complaints to provide education, and a plan for coming into compliance. But clients and customers should adhere to posted notices from businesses or establishments or risk not receiving services. And businesses and establishments should adhere to the guidelines issued by DCOE to reduce the risk. If you're an individual that needs accommodations based on health issues, make your needs known to the management team. And face shields can be used as an alternative. Public and private schools, as they enter, will be requiring students and faculty returning in the fall for in-person instruction to wear masks. And I come back to wearing a face covering or mask is a public health issue, not a political or a constitutional issue. So as we enjoy moving into phase 4, we're doing some changes in our reporting. Because the state of Illinois Department of Public Health is now reporting county level data, we will no longer be providing a daily report of county level data. The new website color codes the counties. If we're blue, that means we're good, we're stable, we're moving in the right direction. Orange means caution. So for those of you who are Illini fans, we've got the blue and the orange in this state. But I think it becomes important when you see it, we will be providing a little daily snapshot. And it will be color-coded either blue or orange to be consistent with the state. And it's more of a weekly analysis, kind of like a daily report to compare to the state, which is a weekly. And it's similar to how we do flu reporting at the state level as well. Because as we move into this phase, we're kind of resetting the clock a bit to kind of take a look and see how are we maintaining, how are we doing in relation to our new numbers. So we will be putting up the case count, the positivity rate, but you will notice that is not a cumulative positivity rate. That is a 7-day rolling average on the positivity rate. The recovery rate, and yes, we call it a death count. And I've heard that people might feel that that's a very harsh word to say, but understand the number of people in our community that have lost their lives to this infection. It is not meant to demean in any way those individuals. For every life lost, we are truly sorry and we grieve for them. But understand, those are those 4 numbers, a basic table to every day kind of take a look at as you assess your risk as you go out. And again, we've made this change to be consistent with local, regional, and state reporting. So today's numbers, we are reporting 14 new cases. Since we've entered phase 4, however, we've had 69 reported cases. Our total cases are now at 3,016. We have no new deaths to report, but our deaths are at 93. No new locations of concern, no new communities of concern. And while our overall positivity rate is about 9%, we are now, our last 7 days has dropped to 4.2%. And our recovery rate is at 95%. We've worked hard to get to these numbers. And wearing a face covering, social distancing, frequent hand washing, sanitizing of surfaces has helped us to get to where we're at. So as we look around states that have reopened and had to close down sectors or consider additional social mitigation strategies due to rising infections and hospitalizations, think Florida, think Texas, think California. Let's learn from them about what works. Wear a face covering or mask, maintain social distancing, and wash hands frequently. This is not hard, but we've got to do this if we are going to get through this pandemic and get to our vaccine. So next I'm going to turn this over to Mayor McNamara.
Thank you, Dr. Martell, and I just want to echo a number of the comments that both Chairman Haney and Dr. Martell provided today. Like both of them, I'm terribly excited that we are in phase 4 of the Restore Illinois plan. But I do want to take a second, as Dr. Martell just did, and go over how we got here and why we're in phase 4. Number one, I think we've worked really well together as a community. We've remained vigilant. We've avoided those unnecessary trips and those unnecessary large gatherings of groups. We've stayed away at times, as difficult as it may be, from friends and family. We've washed our hands, we've worn our face coverings and or masks, and the work that we've done has been working. This is not the same in other states. We've seen across the country in some of the most populous states that happen to open up a little bit more aggressively, that they are seeing tremendous spikes in their cases. They've seen a lot of increased pressure on their healthcare system and their hospitals, and this is a cause for concern for them and for all of us. The news here in Illinois, however, is much better. Case counts and loss of life have dropped. We have right now really strong healthcare resources here in our community and across the state. As we're seeing the public health news improve, we also understand that we have still many citizens and business owners who are continuing their struggle. At the city, we are continuing to work with our residents who are struggling due to COVID-19 to provide them with help in getting the food that they and their families need, as well as assistance with their utility bills and mortgage payments. We are also working with our business owners so that they can stay open and continue to employ their employees. We have a lot of work to do together to restore our economy. We have tremendously difficult days ahead of us when it comes to restoring our economy. But working together, I'm incredibly confident that our community will not just reopen, but we will rebuild a community that we want to see, and one that respects every citizen who calls it home. While we're seeing the signs of progress, we have to continue to be smart and be focused. And I think this is a common theme that you are hearing from all three of us today. COVID-19 does not care what month we are in. It doesn't care how difficult of a fight we've had for the last several months or what phase we happen to be in. It is in our community, it is in our state, it is in our country, it is alive and well. And just before I close my remarks, I really want to discuss face coverings, and this has been a topic now of all three of us, so hopefully it is getting home to all of you watching or listening today. So since Friday, we've now been in phase 4. The very same individuals who were emailing me and calling me about their concern of how they were going to keep their businesses open, how they were going to be able to feed their children because of all the mitigation efforts that we have had to put in place due to COVID-19, are now calling me again and emailing me again. But they're not emailing me out of concern for their bottom line. They're emailing me out of concern for our community and for their employees and for the health and wellness of their own self and their employees' children, because people are not wearing their masks or their face coverings. It is incredibly easy. I happen to choose a Chicago Cubs one because they happen to be the best baseball team in Major League Baseball, but you can wear any face covering you want to wear. It is an executive order. You need to be wearing your mask. To all businesses who happen to be watching today, if you're requiring all of your employees to wear masks, you're enforcing the wearing masks and face covering, thank you. For those of you who are not, you really need to be protecting yourself. You need to be protecting your employees and their families, as well as other citizens who are coming into your place of business. To residents and visitors, I get it. I wear glasses. It's one of the most annoying things ever when it fogs up. I understand the inconvenience, but it is literally just an inconvenience. Wear your face covering. When you're walking into a restaurant, wear your face covering. Respect them. As Chairman Haney mentioned, I thought he used a great word. We have an obligation to those frontline workers. We have an obligation to those business owners who have sacrificed so much for the well-being of our entire state and for our city of Rockford and Winnebago County, that the least we can do is play our incredibly small role that is incredibly easy to do. Wear a face covering. It's been mentioned, this is obviously not a political issue. It's simply a medical issue. I really don't care who you voted for, who you're going to vote for in the next election. I don't care what signs in your yard today, who you think sucks, who you think rocks. I don't care. Just wear your face covering. It'll make all of us a lot healthier and allow us to continue to move forward. Wearing a mask helps prevent the spread of COVID-19. It is that simple. It keeps you healthy. Quite honestly, it keeps me healthy. And by keeping me healthy, I then get to keep my 3- and 4-year-olds healthy. And when I talk about myself, I mean all citizens. So please, as we continue to make progress throughout the state of Illinois and in our own community, I'm just asking that you continue to be and continue to remain vigilant. Wear your face covering. Practice social distancing. And please, wash your hands frequently. Thank you.
Questions?
Dr. Martell, last time we talked about business compliance with face coverings and making sure they're keeping their patrons safe. You talked about kind of more or less a watch list from the county. Have there been any businesses added to that list? Kind of take me through what we're looking at from the first week of phase 4.
So, during the first week of phase 4, I've alluded to the number of complaints and calls we get. We keep a list. And again, if there are repeated complaints against the same site business, and nowadays with, as you would guess, with social media and smartphones and pictures, we're able to kind of take a look, and we will go and provide education. Oftentimes when we arrive, they are wearing their appropriate face coverings, masks. They have the signage up as you enter their facility or building, and they're in compliance. Then we have others that do not. And we work with them to get them the signage from the DCEO. We remind them of what the state, the executive order is that exists, and we will continue. And remember, we've talked about this kind of in the past. We have not had to use it, but closure for public health reasons is under the authority of the local public health department through its authority with the Illinois Department of Public Health. So if a business continually is in violation, either because they're not going to put face coverings up for whatever their view, then eventually we will have to work through that process. For food establishments, we have a little bit different process in terms of code hearings that we can go through. City of Rockford and I believe City of Beloit both have a fining process as well that's involved. But I really want to kind of come back to, it's really complicit. If they want to maintain their business, it's the best investment they have. It's their investment that they've had to suffer through for 90 plus days. To risk it now over face covering, or not making sure their employees wear face coverings, or offering to people that come in, and making accommodations for those who have medical contraindications who can't do that. I have to say, I have to wonder what that, are you really, how much you really care about that business. Because at the end of the day, that's your asset. That's what you've invested your life, your savings, your I'm going to say your heart and soul into. And to not protect it and to not prevent illness in it is frankly very hard for me to understand. When we're spending valuable time with code enforcement officers who could be going out to look at blighted properties, doing other kinds of needed public health services in the community, or having to go out to tell someone about the importance of wearing face coverings. I want to say, is this how we want to spend our resources and time? But it is that important that we will do it. And we will follow all and use all of our tools that we have available to us to enforce it.
Right. Going off of that, if I recall from the last meeting, is that there was going to be some sort of public indication of whether restaurants or whether businesses were in violation. Is there any update on that? Is that the case?
I'm sorry, and I'll repeat the question. I'm still not trained well on this one. I'm good on the face covering, not on repeating the question. So the question is, will we be posting it? We will post all closures on that. It will be on our webpage. So either they're being closed because they really cannot come into compliance. And that is standard. We usually report it in our monthly Board of Health report, but we recognize we've not been able to issue that, so we're going to put it up front and facing because the community can then make a decision if XYZ establishment has been issued an order of closure for failure to comply with executive order. You know, first of all, before you go there, and you can make a decision as an informed consumer whether you want to continue to patronize that place. Now, once that closure is lifted, so if they come into compliance, we don't want them sitting on that list forever. We will remove them off of that list, right? So we don't want to harm a business. We want them to come into compliance. That is our intent. And I have to say, for the most part, right, we always have a few, and I mean a few, that have issues with that. But again, as people moved into phase 4, you would have thought that we would have less complaints. And what we're finding is more complaints. And so I think it becomes important to everyone to understand is phase 4 is not full out open, right? It's not life back to what we knew it. That's phase 5, and that's quite a ways down the path. So phase 4 still requires face coverings, social distancing, frequent hand washing, and understanding that those crowds of under 50, a group size, I don't even like to call it a crowd, group size is under 50, and being thoughtful about that as we've moved through this.
Just one last thing to clarify. Maybe I mistook or maybe I read into something that you weren't saying, but at the last meeting it sounded like whenever there was like a formal complaint or formal so on and so forth, like the county goes to that establishment and they find to be in violation. I thought that was going to be made public knowledge, but it is only going to be if they're closed.
Correct, and that's, they can either voluntarily close if we go in and say you're in violation, or involuntarily close because they're refusing to comply. Now, this is a tool that we've had for other kinds of, I want people to be clear that this is something that public health uses as part of their tools, right? We've had that all along. So for instance, in a foodborne illness outbreak, we may close an establishment until the source can be identified and they re-clean and sanitize and they redo their processes. And so this becomes that forward-facing, and we only want to do it for validated, right? So anything, I mean, we get a lot of, I'm going to say through the COVID hotline, anonymous complaints, pictures, and again, we want to be responsive to the community and at the same time respectful to the businesses about we would not want to just voluntarily put them on a list without validating the complaint and working through the process.
Right, validating complaint was the term I was looking for.
So with the 4th of July holiday coming up, what are concerns you have and how should people go about going out and everything?
So the question is, what concerns do I have about 4th of July and people going out in the public? Well, we talked about that safe, low risk, high risk. So we have, again, many communities have canceled fireworks displays because, not because they're anti-fireworks or there's a significant danger associated with fireworks. It has to do with containing group size. And so even as if you decide to pull your car over or you're going to get a parking space to watch it being shot off from another community, if other cars get into your space and you're all sitting outside, maybe you flip down bring a couple of lawn chairs, you flip it down, and all of a sudden that group size starts to get together. You should be masking up and deciding, do I want to stay? Do I want to get into a situation where I'm going to be congregating with households and community people that I don't necessarily are part of my routine group? Because that's an exposure. We've talked about counting those exposures. So for instance, I could have these 4 people come to my house for 4th of July because they're, up on the stage with me on a regular basis. But seriously, when we get to another place where all of a sudden you're exposed to people, you typically spend, more than 15 minutes for a fireworks display, right? And so you have to be thoughtful. And if you're going to bring your children with you, if you're going to bring your grandparents with you, you have to be thoughtful. No one's going to tell you yes or no. That's not what this is about. It's trying to provide you with the tools so that you can make the best choice for yourself. And it was not meaning to be difficult for people to understand, but again, if you can take on those exposures, you as an individual can make that choice. But you've got to think of all those other scenarios that I talked about. And I think sometimes people think, well, it's one night, I'm just going to go, hang out with the group and we're going to go whatever. And the next thing you know, there's an exposure. And the question is, can you be off from work? Did you tell anyone in your family you were doing that? Did they get a choice about, wow, maybe you shouldn't have come home that night and stayed away for 14 days. Where are you going to, hang out? But it's understanding that. So 4th of July, we want people to celebrate our nation. We want them to enjoy the things that, are safer versus higher risk. And understand that we have, put together some of our things have returned that allow some of that. So baseball will be played on 4th of July. There are things, I know, streaming on YouTube that are going to they're going to play for the nation, some of that going on. But be thoughtful, because you're not going to see any of us telling you, you can't do it. What we rely on our citizens is to understand the risk and take the appropriate risk based on their situation. and our community as a whole.
We talked about 4th of July being one of those big gathering moments, and we're about almost a month removed from the original gatherings for when protests were going on early on in the Winnebago County area. Have we seen any type of bump in cases that you would attribute to that in any way, shape, or form?
Not at this time if you were looking at our numbers, but I also commend protesters and all the staff that are around that. Remember, I said we certainly support peaceful protests, but one of the instruction was to bring a mask, and we are going to try and socially distance as much as possible. And I saw a lot of the feed from many of your news media showed individuals with masks on, and again, trying to maintain social distancing. But certainly there was an understanding that that was a risk event, and they lowered the risk by wearing face coverings and masks.
Mayor McNamara, Chairman Haney, I don't mean to leave you two out, so.
Oh, no, go for it.
But obviously, this is the first week of Phase 4, the first week of kind of an opened up business sector in at least some way, shape, or form. What's kind of been the response you've gotten from businesses? How are they doing so far in Phase 4, and what are they kind of looking at as this forecast for further, and obviously will last for some time in Phase 4?
So from the question I just got was we just opened up in Phase 4. How's the business community doing in Phase 4? The conversations I've had, and I would say I've had numerous conversations at this point with business owners, is their businesses, by and large, doing very well. But that is very well compared to what it was doing for the last 90 days. They're certainly not where they were pre-COVID. I would say many of the conversations I've had with smaller businesses, we've made a number of accommodations for small businesses and locally owned businesses in the city. If it's extended seating and things of that nature outside, they're thankful that those options continue to be available for them and will be for the rest of the summer. I would say, and I'm not just playing to my discussion earlier, truly the biggest concern I continually hear is either employees saying that their business owner or manager, if it's a national chain, isn't enforcing face coverings and they're really nervous and scared to go to work because of the health and safety of their own family, or a lot of small business owners are coming forward saying, hey, I've dealt with 90 days of pretty much no income, or 20% of what I've been used to. These folks wanted to be in my restaurant so darn bad, and now they can't follow the simplest of rules. And that's probably the nicest way I can say it, since I'm on 3 TV stations. But it really is unconscionable that you have citizens who've asked to get open, and they just can't follow a simple basic rule. And we're not talking even yet about kids in school. We're talking about grown adults who can't follow simple guidelines and recommendations from medical experts, not from politicians, but medical experts like Dr. Martell and others. So I've heard good things about our business community continuing to advance, but they obviously all want to get to that Phase 5. Specifically, I would say a big concern for us is the tourism and hospitality area. You're seeing thousands of our citizens who are unemployed right now. Don't hold me to the exact number, but I believe between about 7,000 and 9,000 of those citizens in our area who are unemployed in the hospitality and tourism industry. We need to get to Phase 5. Our economy, we are fortunate to have the Convention and Visitor Bureau and so many wonderful natural assets and local assets in Rockford. We have to get to Phase 5, but to do that, we need to all do it together. I'll let Chairman add.
I'll follow up Mayor McNamara's comments about feedback from the business community. I think after a very long time of coming to terms with what has changed, now that we're into Phase 4, the feedback I get in particular from retail and from restaurant owners is a growing awareness around the long haul. The idea that there is concern that if we don't do the things we've emphasized time and time again, that you could see us going backwards. And so there is this, I guess, sobering, focused series of discussions around what do we need to do to continue to make incremental progress and to make sure that we're not going backwards and we're in a position to go forwards only. That's what I hear from folks. There is a seriousness in the discussion, an awareness and respect that many of the things that have been put forward in terms of mitigation of the spread of COVID-19 is actually in the best interest of their business interests. And this is the best thing for our economy, is to take this very seriously right now. Any other questions?
Can I add just one thing?
Sure.
You mentioned a business question, and this isn't necessarily a for-profit business, but in the business of serving people, I would say I still have a really strong concern about nonprofits and their health and vitality. I understand we're in unprecedented times, and that word's overused. I get it, and I understand we have tremendous unemployment. I would just make an urge for anyone who is able to continue to give to those nonprofits. They are seeing their services needed more now than ever, and their revenue is dropping precipitously. So I know it's a big ask, I get it, but if you have the opportunity to provide any funds to a local nonprofit, they are really struggling. And we talk about the group sizes up to 50. Well, they can't have those luncheons, those events that they typically would to garner large sums of funds. So please, if you are able, and I understand many are not right now, but if you are able, please consider going back and providing an additional gift to those nonprofits who do a lot for us.
Any other questions? Okay. Thank you very much, everybody.
Thank you.
Thank you. That's great. Kathy Ford.
Good job, man.